Welcome everybody from across Western Australia. I acknowledge that we're meeting today on the beautiful lands of the Whadjuk Noongar people and pay my respects to elders past and present, and of course to all elders across our magnificent state. Welcome everybody, thank you so much for joining us today. Today's webinar is all about the Department of Community's commitment to supporting the community sector through the provision of PPE and RATs, as well as funding to support community sector partners in cleaning premises after a positive case is detected, and support to develop a surge workforce capacity for the community sector. So this work has come about mostly in part because WACOS has made very strong representation to the state about what the sector needs, and we're really pleased to be able to provide this and support the sector through this next phase of the pandemic. Communities, through the COVID Incident Management Team, known within our department as COMIT, will be supplying PPE for community sector partners, and the COMIT team will be speaking during this presentation to give you more details on that. Communities has also committed a $1 million grant to assist community service organisations to recoup cleaning costs in responding to confirmed COVID-19 cases, as well as provision to WACOS to identify and develop measures to assist in surge staffing in the community sector, and Louise Gelotto will be speaking about those two things. The webinar is a great opportunity to address some of the concerns of the sector in regard to the provision of equipment and logistical support in response to COVID-19. The various speakers that we've arranged for you today will focus on each of these areas to ensure that you have the most up-to-date advice on all of these important issues. So the speakers today will include Louise Gelotto, the CEO of WACOS, Kylie Mayo, the Executive Director of our COMIT team here at Department of Communities, and Scott McGill, the Deputy Director of COVID-19 Coordination at the Department of the Premier and Cabinet. So we're hopeful Scott has joined us or can join us later. So you've already provided a number of questions to us for this session today, and we'll be taking additional questions throughout the chat, which will be moderated by Louise Gelotto and Rachel Seelett from WACOS. With that, I'd now like to hand over to Louise to make some opening remarks, and I think she has a little presentation which we will upload for you now, Louise.
Thank you. While that's being uploaded, firstly, I wanted to also acknowledge the traditional owners in the land in which we meet. I'm meeting on the land of the Whadjuk people of the Noongar Nation and pay my respects to elders past and present. I also wanted to thank Mike Rowe for quickly and the team at Department of Communities for pairing this webinar today, because we know there's lots and lots of questions people actually want answered. I've committed to keeping mine nice and short because we want to give plenty of time for questions, and please pop your questions in, not the chat, but the little up on the top, there's a question mark circle. So pop them in where there's a question mark and there's a circle. So can I just go to the next slide, please? This is the criteria of what, as Mike's already mentioned, WACOS has been granted $1 million to do a reimbursement scheme for the community service sector for if they have a positive COVID case, and that there will be an assumption, additional cleaning cost, and that you can be reimbursed for those costs. So we've outlined the criteria there, and I've asked for these slides to be made available straight after this webinar, but if you want to formulate some questions, just take a quick photo with your camera, because I'm going to go through this pretty quickly. So this is for community service organisations right across the board, not just for Department of Communities. So basically, if you get a state government contract, you're going to be eligible. The cleaning is required to a positive COVID case. Cleaning must be done with approved TGA products. Now, we'll provide some links with that, and the next one is also in line with the Chief Health Officer guidelines. You might think that's being a bit stringent, but if cleaning is going to be done, we want it to be done properly, and it just outlines the type of products that you need to be using. We're no longer talking about deep cleaning. That's not one of the things that the Chief Health Officer is actually recommending. Funding will be made available upon receipt of, that you've actually spent the money. There is no limit to the number of times you can actually apply, because you might have to do, multiple times. You might have to do additional cleaning. There is some restrictions because it is only $1 million. Not to be used for reimbursement for regular cleaning. So you should most organisations pay for regular cleaners. This one's a bit difficult, but it's not for aged care or NDIS federally funded programs or individual NDIS care packages. But you could be an aged care service that you get state government funding, or a disability service that you get state government funding, so you can apply underneath that banner. And we will backdate claims to the 14th of the 1st of this year, because we know that the cleaning's actually, organisations have already had positive COVID cases. We're hoping to have this system up and running within the next couple of weeks, and it'll be an online system. I really want to make it clear, WACOS is not a grant maker. We don't want to be a grant maker. Therefore, if you meet the criteria, you will get the reimbursement. We're not going to be making judgment calls. So we want to make that criteria really, really simple, and it'll be very tick a box that you'll be agreeing that, yes, you are using these products, and basically here's the receipts. So as I said, take a photo of that and you can pop some questions in. The next slide, please. Surge workforce. As Mike also mentioned, we've been resourced to actually develop a surge workforce. Our employee started on Tuesday. His name's Milan. He's actually online now. We know, and it's been said at several forums, there isn't a cavalry of people that are up on the top of the hill that are going to rush in and help and support organisation for the critical workers. And I really want to stress this is about the critical workers, not all essential workers. So that's things like in residential settings, for homelessness service, and there's a whole bunch of services that are actually critical, but that's what we're concentrating on. We've got another working group meeting this week, and we're hoping very soon we'll have information out. Our workers already met with the lawyers to make sure our MOU is going to line up. We're meeting with unions, so we're trying to, and meeting with insurance companies, trying to cross all the T's and dot all the I's. Information will be coming. It's totally voluntary if organisation want to join, but we will be asking you to do a lot of paperwork before you actually need the critical workforce, that you've signed the MOU so you understand. So when it comes to that day that you may need an extra 3 or 4 staff, and we'll be calling on your colleagues in the workforce, a lot of the paperwork's already set up. Last slide, please. You may want to take a photo of this. These are just some contacts for now that I've referred to in my presentation. So I'll keep it nice, brief and short. Back to you, Mike.
Fabulous. Well done, Louise. Very nice and tight. Thank you very much. I'm now going to hand it over to Kylie Mayo, our Executive Director in the Community's COVID Incident Management Team, known as COMIT, to speak about the distribution of PPE to the sector. Over to you, Kylie.
Thanks, Mike. So welcome, everybody. I'm going to give you some information just about how we are allocating and distributing RAT and PPE, rather than the detail of the actual policy, which I will leave up to our colleague from DPC, Scott, as he comes on. So would you mind just popping through to the next slide? So we'll just talk about rapid antigen tests for the moment. So rapid antigen tests, in terms of the allocation that we currently have, there are 2 components of that. Firstly, and primarily for furloughing critical workers. And I'm sure that most of you will understand the critical worker furlough policy and be aware that the critical furlough policy is actually being released by the Chief Health Officer. So the first allocation is just for furloughing critical workers, and then we have a smaller allocation which can be used for service users, and I'll go through that. Next one, please. Just putting the link into the Premier's announcement, just in case you do want to go back and actually have a look and understand that our role as communities is actually to distribute to community services and to childcare, early childcare providers. So we'll be doing both of those. Next. So as I said, to support the critical worker furlough policy, and that we do have some allocation for high-risk service users who may be symptomatic. So these are not to be used for screening purposes, more to the point that if you have a client who looks unwell, who may or may not be able to access a testing site, or may not be willing to attend a testing site, it will allow you as a service provider to be able to say, hey, would you like to take a test? It's just, you know, that whole beautiful thing of, you're here right now, let's take advantage of that opportunity and not put them off by making undue pressure for them to go to a pathology site to have a PCR. So that's what our allocation is about. So next. So we will be distributing to community service organisations on behalf of ourselves as communities, Department of Justice and the Mental Health Commission, not the Mental Health Commission, so that's my bad. Isn't it always lovely when you see your own spelling mistakes? Thank you. They'll get me for that later. Next. Okay, so what do you need to do to take advantage of that? So you need to register your critical workers with the critical worker furloughing registration system. We'll provide a link for those of you who don't have it, but it's really important. It doesn't matter how big or small your organisation is, that if you have critical workers, you've got to be registered on that system, okay? We will send you an email that'll include the number of RATs that we've estimated for you based on the services that you provide, and where you can collect. So, and there will be metro and regional collection points. And we'll also suggest a time, just so that we avoid a bit of congestion at the site. It's not hard and fast, and you can negotiate that and turn up at another time. It's just for your benefit that you haven't got long waits. And we will also ask you to bring a copy of the email so that the poor store person who's going to be there helping you on the day knows that that's the allocation that you'll be getting. And again, like Louise said, we're trying to make it as simple as possible, so you don't have to give us lots of, you know, sort of your war and peace about your organisation. Just simply bring the email that we send you, and the person who's at the distribution centre will know exactly how much to give you, and just tick off our box that you've come and collected that. So we just make it very, very simple for you. Next. So next, about personal protective equipment. Oh, sorry, I'll just back to the RAT. Just if you are a service user that we're allocating RAT to, so your organisation, we'll contact you directly. So you don't need to contact us. We'll contact you directly and let you know how much we've got. And when you come and pick up your critical worker allocation, you can also pick up your service user allocation. Okay, so personal protective equipment, again, this is just talking about communities. So it's for accommodation and residential settings only at the moment, because they're our priority at the moment. So I'm sure that most of you will be aware that the supplies of PPE across the country and globally is quite constrained. It's about a 50 times extra demand on the sector for the provision of PPE. So it's a little bit tricky to make sure that we've got good ongoing supply. So right at the moment, we're concentrating on those services that are most at risk, and the most at risk at the moment are those who provide care within a residential type setting. So refuges, residential aged care, residential disability services, child protection, those sorts of things. Next one, please. So who is eligible? So obviously we're looking at those services that provide accommodation or are providing services within that residential setting. And we're only at the moment providing 2 services that hold an agreement with us, and that service agreement provides services within that accommodation or residential setting. Yep. So the package that we have put together at the moment is we're actually using some of our emergency stock, and we know that it's not complete and we will have to supplement that a little bit. But it does contain all the items that you'll need right now. So if there's an outbreak right now, it's about getting as much stock to you as we possibly can in the shortest period of time. So we're using these kits, and then we'll come back and supplement. Next. So what's in it? So you'll get, apologies, that is not, the first one is not disposable gloves, it is disposable gowns. So you'll get disposable gowns, surgical masks, powder-free gloves, hand sanitizer, and some safety glasses. We have ordered a whole heap of reusable face shields as well. But rather than holding up this order and waiting for them to come in, we're going to push these orders out, and we'll get those face shields out, and additional disposable gowns and masks will come within that supplementary pack. What about N95s? And I wanted to just address this straight up. Currently, there's not a lot of N95s out there. If anybody wants to have a discussion about N95s offline, I'm very happy to have them with you. An N95 mask, there are lots of different types, and it's quite difficult to actually make sure that you get the right one fitted to your workers. So It's not one size fits all, so it is quite difficult at the moment. There will be a further distribution centralised through the Department of Finance, because obviously at the moment most N95s are being allocated to health. There is an option in the health circular, and again we'll circulate that link, which actually does say that agencies can use surgical masks with face shields and or goggles. Some people are doing both, but you don't need to do a face shield and goggles, but it's about what is fit for your service. So, but we'll make sure that both are available. So right at the moment, we won't be allocating our N95 masks, and we're not allocating them for our own staff either at the moment. So just so everybody knows. And I think that's about distribution. Okay, so PPE, as I said, we put in the initial emergency kit order. That will be ready, I think, next week. Yep, so we're going to try get those allocated out next week. And then as soon as we have a timeline on the additional gowns and face shields, we'll let you know as well. And we're currently working through a process for other community service organisations to register what their requirements are, so that we can keep those further allocations coming. So we're not abandoning you, we're just, it takes a little while to get that process in place, and we're currently getting that process in place. Priority, residential, making sure that you have enough so that if you have an outbreak, you can immediately jump in and provide appropriate PPE to your staff members. Okay, and that's it.
And the timing of RAT's provision?
RAT's provision, so we have them in the warehouse today, which is fantastic. There will be some organisations that we'll be talking to today that may be able to come and pick up some allocation tomorrow. But the more streamlined process we're aiming for early next week. So given it's a public holiday on Monday, we're hoping to have everything ready for people to start coming through on Tuesday, but there will be some larger organisations that we may be able to actually get an early drop for tomorrow. But if that's you, we'll be making a phone call today or tomorrow morning. Regions, so Troy can tell you which are the sites for the regions, is that okay?
Yep, so the regions, we'll be reaching out to the regions by the end of next week. There's a number of key locations. Obviously, we're partnering with Food Bank and utilising Bunbury, Geraldton, Albany, Kalgoorlie and Mandurah. So they're the 5 Foodland premises that we will be partnering with. And then we're working a couple of other locations, well not a couple, locations around Esperance, the Pilbara, the Kimberley and other sort of more remote areas. So we're just partnering up, and that will be communicated in the email that goes out to all CSOs.
Thanks, Troy, and thank you very much, Kylie. Okay, so there's no doubt plenty of questions coming through, I'm sure, and we've already got a stack before this event. But before we get to that, so please keep using that chat function to get those questions in. Before we go there, let's hear from Scott McGill, the Deputy Director of COVID-19 Coordination, who will talk to us about the provision and distribution of RATs to the community sector in a more general sense. Thanks very much, Scott, for coming today. Over to you.
All right, thanks everyone. Can you hear me all right? Can I just get a sign from the hosts? Yep, great, thank you. All right, so the slides we have today are a bit more detailed than the ones you've seen previously. So I won't actually talk through every point of the slides in this particular presentation, mostly because it does step out some guidance on the critical workers register. I'm mindful that a lot of organisations would have already received some information about this, but I thought the detailed slide back would be useful because we can send it out after this session, and it might be a really useful how-to guide for those who haven't registered yet and haven't received a proper briefing on how to register. And I'll come to the specifics on rapid antigen tests at the end of this presentation. So I'll just talk through the critical workers bit first. So if I can go to the next slide, please. Thank you. So the critical worker furloughing policy was announced on the 28th of January, and the register for employers of critical workers went live on the 21st of Feb. So the critical worker furloughing policy is not yet active, and when it is actually activated will be based on on advice from the Chief Health Officer. So the intent of the critical worker furloughing policy, for those who aren't aware, is during very high caseload settings, which again will be determined by the Chief Health Officer, during the peak of our outbreak. It's a protocol whereby certain critical workers will basically have an exemption from testing and isolation requirements, but there are certain risks associated with it, which is why it's not a policy that can be activated before we reach what the CHO determines to be very high caseload settings. So if I can move to the next slide, please. So as I said, the critical worker furloughing policy relates to a very, very specific cohort. So if a critical worker, so that's someone who meets the set of definitions I'll go into shortly, is a close contact but does not have symptoms, they can attend work during the 7-day period of isolation in very specific circumstances and if they meet strict criteria. So the definition of critical, which also has been quite precisely framed, it's about the delivery of services that are essential to the health and safety of the community. It's not about critical to the ongoing operation of any business that considers itself critical, or any organisation, in fact, that falls on within the list of industries that are identified. It is only certain workers in those specified industries. So just to give a private sector type example, it's if it related to sort of a a meat company, the critical worker policy is not intended just to make sure they can continue operating and turning a profit. It's about making sure they can get meat on the shelves because that's necessary for people to be able to eat. So it's really important that we understand what critical means in that context, and that when organisations come to register as an employer of critical workers, that you're looking at it in that context. It's also worth noting that the critical worker furloughing protocol should be, in some respects, a last resort in terms of an organisation's risk management or business continuity planning. So when an organisation registers, it will need to declare that there are other plans in place for business continuity, for COVID safe practices, etc., in place, to make sure that we're using all of the means available to us to operate in a COVID safe way before relying on a protocol that allows people who are close contacts to come into the workplace. And I'll step out this a little bit later, but it's worth bearing in mind that the organisations themselves activating this protocol, it is about having people who have been identified as a close contact within a pretty strict definition of what a close contact is presently, actually coming into the workplace. So the organisations themselves do carry some risk, so it really ought to be a last resort. And just lastly, there are a range of approaches that have been taken to critical worker furloughing around the country, just reflecting slight jurisdictional variations, but our position is broadly consistent with the national approach and the advice of the AHPPC. So if I can go to the next slide, please. So this is a flowchart that hopefully will be useful for people to take away after the session to assist in actually going through the registration process. This one steps out the actual policy criteria for what a critical worker or an essential worker is for this purpose. So basically, there's three instances in which a worker may be considered to be critical. Firstly, is the worker performing a role that's critical to the state's COVID-19 response, or does the worker perform a role that is critical to the continuation of critical services that present significant harm? Now, without going into too much detail, those first two criteria are very, very select groups with a very, very high threshold. That's why we've got words in there like catastrophic. We're talking about catastrophic impacts. That's because these ones are not linked to a particular set of industries, and they are in there specific as a catch-all, so that if we have not identified an industry that has workers that ought to be considered critical, certain workers may still be considered to be critical, but the threshold is necessarily very high. So the third set of criteria, which is whether a worker is in an essential industry and captured under one of the specified categories, this is where the overwhelming majority of critical workers will actually come from. So there's a few examples here. There is a more exhaustive list available on our website. It's quite a broad and permissive set of industries, and in relation to social assistance and residential care, there's quite a few subcategories that we've identified as being critical. So this is where I think the vast majority of registrations will actually be, and that's been our experience so far. So here, if a worker is identified as critical, meeting these criteria, then there's an assessment as to whether that worker is necessary for the safe continuation of services in that industry, or whether they provide specialist skills in that essential industry. So it's important here that it's firstly, does the worker work in this industry, and does this criterion apply? It's not every single person who works in each of the listed industries, and in fact we expect in most cases it would be a minority. And I'll go through the actual test for the individual worker on the next slide. So if I can flick over to that one now, please. So again, I won't talk through this in excessively exhaustive detail, but the first test, and this is normally the one I guess that when people initially sort of think about what critical work is a lot of them I guess get knocked out because the work can be done from home. Won't apply to a lot of organisations and to a lot of roles, but that's just within the intent of the policy criteria. If it's something that people can do from home, then there's no reason for them to come into work and for the organisation to wear the risk of having a close contact in the workplace if the work can be done at home. So there's a range of other criteria here, including can a colleague safely cover the work? Can the role or worker be replaced on a short-term basis through other business continuity type mechanisms? Does the worker have any COVID-19 symptoms? Has the worker confirmed consent to return to the workplace, and have they provided a negative RAT? And the requirement will be a daily negative RAT test for the 7 days of isolation. If the answer to any of those questions is yes, then some other testing and isolation protocol applies, or if they become a close contact, and it's only if all those conditions are met and cannot be dealt with through other means that a worker will be permitted to come into the office or into the workplace, despite being a close contact. And if at any time during that period they develop symptoms, then again, there's another testing and isolation protocol that applies to people with symptoms, and they must isolate. So I'll move over to the next slide.
So Scott, just a quick process check. We've got like a minute and a half left for your presentation before we need to get to.
Yep, no worries. All right. Well, again, these are technical details about the register itself, about who in the organisation can in fact register. So I won't go through this one in too much detail. It does need to be the CEO or a CEO delegate, but the instructions in this slide and online ought to be sufficient for organisations to be able to get through the registration process. So if I can move on, please. Now, rapid antigen tests. It's worth, I guess, going back to what feels like a really long time ago, January 2022. That was when it actually became legal and permitted in WA for a rapid antigen test to be used outside the supervision of a medical practitioner. And it's worth remembering that by that point in time, governments around the world were trying to buy up, but governments and private organisations were trying to buy up every rat they could get their hands on. And supplies since that time have been quite constrained. Now, government's taken a centralised procurement approach to buying a large stock of rats through the Departments of Health and Finance, and that's to ensure that we don't have lots of government organisations and government funders competing with each other to take rat supplies out of a constrained market and allocate them how they see fit. And this is mostly because the public health system needs to be the priority for rat provision as we get into the beginning of our full epidemic. And while supplies are constrained, the number one priority will be the health system. Now, the second and third priorities beyond that will be critical workers in line with this protocol that I've just stepped out. And in addition, you'd be aware that the Premier announced on Sunday a distribution of rats to households. The primary purpose of that is to ensure that as far as possible, people have the opportunity to get some free rats from the government and have a stock of a few rats at home, so that if they are identified as a close contact or they become a positive case or whatever occurs, and they are required to isolate, and all of the testing and isolation protocols do involve testing during the isolation period, that they are able to take a rat test on day one if they need to. So the distribution to households is not, again, people have a degree of discretion around how they use them, but it's not simply a matter of giving everyone a free rat to do with whatever they will. People are strongly encouraged to hold on to at least some, so that if they are identified as a close contact, they don't go to their isolation period via the supermarket or the chemist to get rats to use during their isolation period. So given that I'm probably slightly over time, I'll probably wrap it up there. But I'm mindful that there are some specific questions that providers would like answered about rats, and I'm happy to talk through those now.
Fantastic. Thank you very much, Scott. And it's straight over to you, Louise and Rachel, to facilitate the next bit of the Q&A, and we'll be as helpful as we can.
Thank you. Yeah, there's already at least 48 questions, another 6 I haven't read yet. I'm going to try and group these questions, and if you could just take down that slide that says questions, that'd be great. Initially, there were some questions about the cleaning products and TGA and regional. I can actually answer that. The link that you'll be provided, these are just products. You type in the product you're using and it will tell you if it's TGA approved. So they should be available in regional areas. There was a whole bunch of questions in relation to PPE and will they be and how will they be distributed to regional areas? So will they go directly to organisations or will there be a pickup point? So I think that's a question for Department of Communities. Again, it'd be great if that slide can come down. So somebody in Department of Communities can talk about the distribution of PPE, especially to regional areas.
Just ordered, they will be going directly to the individuals, so to the regional entities themselves. But going forward, we will try and utilise the hubs as often as we can when there's large quantities going out to the regions.
Thank you. And there's a series of questions from different types of providers. So you've spoken about PPE for communities. So I'll just backtrack. Cleaning and the reimbursement is right across state government contracts. So that's really clear. But for the PPE that you've spoken about and the initial packs that are going out, they're just for Department of Communities. So what's actually happening for disabilities, mental health and other areas? Who will be supplying their PPE?
I'm not sure whether Mental Health Commission are actually on. They were going to join us today. So I sought to find out what's happening with them at the moment. They are not providing PPE to their providers at the moment. So I really can't speak on their behalf, but I understand that it's not. And my understanding is that if you're a disability service provider and you're providing services to us under state government contract, we will supply. But if they're NDIS, then the NDIA will supply through there.
Rachel, do you want to ask the next couple of questions? We'll just tag team.
Yeah.
You're still on mute, Rachel.
I definitely pushed the button, but I didn't push it hard enough. Apologies, folks. There are quite a few questions around PPE, as you will appreciate. So we've already dealt with the issue around they're only for, to be clear, they're only for people that hold or organisations that hold contracts with communities. There's questions around the masks and being clear that N95 masks aren't being provided. So I presume, therefore, that is surgical masks. Is that correct?
Yeah, the PowerPoint, if you go back into the Department of Communities PowerPoint, it showed it was surgical masks for the high residential, but there'll be goggles and they were talking about face shields. Yeah. So it's not KN95 masks.
So because there's some questions around that. There are a number of questions around rats and the availability of when they're going to get them, particularly in regional areas. Again, that we're coming to regional areas. There's also the issue around And one of the slides said they're available for potentially for some screening. So there's some questions around that issue in terms of if they can be used for screening for residential services. There's so I'll stop there because there's a series of them on rats.
Okay, so I think, Rachel, that might be a language issue. So people use words of surveillance and screening and all sorts of things interchangeably. Surveillance is when you just do a rat just as a regular every day or like twice a week. That's surveillance, right? And that is not what these are for. When we talk about screening, it's not screening in terms of you're coming in here and I'm going to screen you to make sure you're negative. What these rats are for service users is to say, hey, John, you look unwell today. Would you like to take a rat test because we want to make sure that you're okay? If that's what they mean by screening, yes, they can use these rats for that purpose, but it really is for service users who may be symptomatic or you may suspect that they may be COVID positive.
I think that makes it clearer. Thank you. One of the specific questions was if they're admitting somebody, a new person into a residential facility, for example, and they look unwell. So what you're saying is they can be used for that purpose.
Absolutely. If they look unwell and you can't get them for a PCR or it's impractical or they would be unwilling to have a PCR, we would always, if you think someone's sick, we would always say get a PCR because it's gold standard, right? But there are lots of reasons why we have very vulnerable clients and we need to be mindful of that. And if doing a quick rat is the best thing for that client and for you as an organisation, then that's what you do.
Okay, thank you. Then there was
sorry, can I just add to that? Sorry, Rachel, if that's all right. Just on that point, thanks for covering that off, Kylie. Just a couple of additional things. Part of the, I guess, approach to testing and including both the testing, the critical workers protocol and also broader uses of rats like that just described. PCR is always preferred. But this is, we're envisioning a situation where our case numbers will get so high that the PCR system will be at capacity. So I just want to reinforce that wherever possible, PCR should be used, largely because rats do have both false negative and false positive results, which create some difficulties for both health and for the organisation managing the client in that instance. The other point to also stress would be that any organisation that is rat testing service users who are symptomatic, it's really important to make sure that there's a robust response plan in place for where you do identify a positive case, and that there are arrangements in place with health, SWIC, whoever's best placed, to make sure that's safely managed for the sake of the client and for your staff.
Okay, thank you.
You just answered one of the questions. Sorry, you just answered one of the questions, Scott, that came in. What happens if a young person comes into a service and they say they're COVID positive? And this comes back to every organisation needing to have a plan. But this also comes to another question that's actually been posted, and I know it's a consistent ask. Many organisations have attended sort of presentations that talk about the difference between SHIC and SWIC and the process and the supports. We still don't have that one pager, and I'm saying it again, that actually gives the telephone number, this is what will happen, this is the process, this is when it will go across to SWIC. It's urgently needed. There's already positive COVID cases, so people actually know the process and what steps to actually take once they've got positive COVID cases. Some organisations know about it because they've sat in meetings, but it hasn't been broadly communicated with the sector. That's really important piece that has to happen pretty quickly.
Yeah, so Louise, we've heard that, caught that one. So Stuart Cowie is prioritising that.
Yeah, so that's come up in the questions in relation. There's been other questions in relation to congregate living. And this is really for you, Scott, because DPC is controlling the supply of rats. So when the 5 free rats to each household, just say somebody's living at St. Pat's and they accommodate 30 or 40 people, they've all got their own unit. Well, each one of those individuals be given 5, because at the moment it's by their location. There's only one street address.
All right, thanks for that. And just a first point to cover off in terms of the decision making around rat suppliers. There's a whole of government process around that involves health and finance who are procuring and obviously some central prioritisation, which is also driven by health advice. So I just wanted to make it clear that in terms of allocation and distribution type decisions aren't being made at DPC, and that as it relates to this audience, communities are handling distribution of rats, just to make sure there's no I guess no misinterpretation there. But on the question about the 5 free rats, there's two intentions to the allocation for service users. One instance we've already talked about, which is in a particularly high risk setting, where I guess there's more than an incidental interaction, and where the interaction between the service user and a staff member or multiple service users would meet the definition of a close contact. So it's more residential type arrangements, where there's the ability to do rat testing for symptomatic people. But separately to that, it's also recognised that there are a lot of service users who won't be able to receive the 5 free rats through the household distribution process. So people who are homeless are the most obvious example. So part of the allocation to community service organisations to provide rats to service users is also outside the sort of settings we talked about before, and simply to give service users their box of 5 rats for them to use as they need. So in the types of settings that you're talking about, which is kind of a bit of both. There will be some discretion for the organisations as to whether they are just sort of doing rat tests for people who are symptomatic, or if it's someone who's doing in a short stay type arrangement and then leaving, whether they're given their 5 rats as a household, because they were unable to receive their allocation through the post.
Can I jump in there then and just follow up in terms of rats for critical workers and organisations? Some organisations have said, well, we've registered our critical worker or critical workers, but haven't received an email even acknowledging, it sounds like even acknowledging that they've registered them. But how could you go into more detail about how that process will work so people are really clear?
Okay, so thanks for that, Rachel. So the register itself is not a rat ordering system. It's the main purpose of the register is for organisations to declare that they basically comply with all of the policy requirements that sit around the critical worker protocol. So what happens is basically that register is there for organisations to do that, and also to declare whether they have or haven't been able to source the rats that they need. But I should stress that it's not I guess a process whereby the individual organisation's declaration as to whether they've got rats or not actually then links to how many rats they get provided with, or whether they get them at all in the not-for-profits sector. So there is a requirement that organisations are registered to get rats for their critical workers, but communities are organising an allocation of rats to all the organisations who I guess meet their criteria for a community service organisation, but they will be required to be registered.
So can I just, maybe Scott, just to clarify, I think Rachel was asking, so for those organisations who have already registered through the system, should they be expecting some confirmation email as part of that system process?
Confirmation that they're registered, or that they
Yes, confirmation that they're registered.
I'll check and see if there's an auto-generated email, but what they should be receiving is as part of the actual registration process would be basically a unique identifier, a code, and I'll double check whether that's supposed to be sent to them by email or whether it's simply provided to them as part of the I guess the online interface with the register, but it would simply be confirmation that registration has occurred.
And Rachel, just another point, as I understand it, Department of Communities has access to that register. So is that correct?
Well, we're supposed to. We don't have it yet. So apparently there's some technical difficulties, but yes, we will, and we'll be able to assist community service organisations that have difficulty with the register, or if they've got particularly issues about what a critical worker is in their context.
But I was also thinking that allows us to see the data that people have entered
Yes.
in order to determine number of rats and things like that as
Correct,
well.
correct. We have access to that.
So just to confirm, you will be accessing the register to determine how many workers have been registered by one of the organisations that have contracts with you to then determine the numbers. And can you confirm what numbers then each worker will get, or haven't you identified that yet?
No, so we're still working through that. We haven't used the critical worker register for this allocation of RAT. We're using the size of the service and what we know in terms of those service organisations to determine what we think is a reasonable amount, so that for what we have estimated, so what, based on some assumptions, what we've estimated that for each worker that needs to come back, which is a proportion of your critical workforce, proportion needs to come back, then we estimate 7 rats for each one of those because they need to test on every day. So that's how we've done it. So we have not gone into the critical worker register. We've just looked at the size of the size of the contract that we have with you, the types of services that we know that those types of services will need and will have critical workers. So that's how we've done this first allocation, because we couldn't wait for all of that. We need to get these out quickly, and we think it's a reasonable first allocation so that most organisations will have at least an initial allocation.
With the priority being those organisations that have a residential care service.
Correct, because they are predominantly the ones that will have those critical workers under the definition. So if you think back to the definition of critical worker, is essentially life and limb. If we don't have workers going in and providing that 24/7 service, our only alternative would be those patients, those clients ending up in another service or us having to close that service. So that's, by its very definition, those people are critical in terms of keeping the service going.
That's a really good time to ask this question, because there's a couple that's come through from FDV services. So in your presentation, excuse me, the initial is for residential services. Are you including FDV in the residential services?
Correct.
Okay.
So yeah, so FDV, and I think for justice, they're also including some bail services as well. So yeah, homelessness, refuges, all of those types of services. Yeah.
That's really good to clarify, because that'll answer a number of questions, and because that applies for FDV and the RATs and critical services as well.
Yeah.
But there's an ongoing question that keeps coming up. Even though Department of Communities is providing PPE, maybe we can take this offline, but people are really wanting to also know from disabilities, and especially the Mental Health Commission, what they're doing, and the Justice as well. So there's a consistent approach across state government, because it looks like there's different standards depending on who's your state government contract from. There's also questions in here around, back to the rats, I knew there'd be lots on this, about will you be supplying rats to remote communities, Scott, and yeah, it says Aboriginal communities, but I'm adding in plus remote communities.
Okay, thanks for that. So is the question just about remote communities or about Aboriginal households in general?
Both, if you can answer both.
Okay, so remote communities, the answer is yes, there's work underway to try and get rats out to those communities, and a lot of the outbreak response planning and that's specific to remote communities does involve the use of, I guess, all of the the risk management tools at our disposal, which includes rats. So in relation to Aboriginal households, there was a question provided before the session about the 5 rats. So the 5 rats will be available to every household in the state who do go through the registration process, and they'll have an option to either have the rats delivered, or if they're in the metro, go and collect it from a particular site. The 5 rats is provided to a household regardless of size. And that's purely because their purpose, for a number of reasons, their purpose is to ensure that that again there are some rats in the household in case anyone becomes a close contact, and they have at least got 1 rat to test on day one of isolation if they need to when we get into very high caseload settings. And in relation to the inferred question as to why it wasn't a number of rats per householder, it was simply a matter of that would have slowed down the distribution process very considerably, because the rats themselves take up quite a bit of storage space in warehouses and in vans, etc. So it was made to make sure we get broad coverage across the state. It was the decision was taken to do 5 rats per household.
There's a number of other questions around critical workers. One was timing around when the decision is made for high caseloads. What level of caseload, or when will a decision be made around when the critical worker process kicks in for community services?
Yeah, well, that's a great question, and I'm afraid the only answer I can give is that will be subject to the Chief Health Officer's advice. There's been no prescribed trigger for what very high caseload settings will mean. So based on the case numbers and a range of other factors, the CHO will give advice as to when very high caseload settings need to be activated. Again, going back to the original intent of this policy, we do have to recognise that having the critical workers protocol in place presents some risk, not only to organisations in terms of COVID spread within their own workplace, but a broader public health risk arises from that. So that's why the protocol has been designed to be active for a finite period, only during the very peak of our caseloads in WA. So there's a range of factors that the CHO will take into account before he determines that the protocol will be activated, and I think it's likely that protocol would be activated, I guess, with relatively little notice, unfortunately. But it is a situation where the CHO has to look at the case numbers on the day, various other factors, and make a decision quite quickly.
Just a quick process check. We've got 7 minutes to go.
Yeah, thank you. And there are so many questions here that people are actually wanting to answer. When will the register be up for people to register to get the PPE from the Department of Communities?
I can't answer that, Louise. We're working on it at the moment, but I will come back to you within the next 24 hours and give you a timeline.
Will organisations be reimbursed for rats and PPE they've already purchased?
No.
Yeah, I knew that answer, but I had to ask it. We did try, WACOS, we did try that. There's been a question around critical workers and volunteers. So when you do a deeper dive into the critical workers, and the community services are there, and if you go to the website, you'll get a further definition. But there's food and emergency relief providers, which are often provided by volunteers. So I think I asked you this question, Scott, in a meeting a couple of weeks ago. The food and emergency relief doesn't seem to be covered under the community service section, but they may be covered under the food and retail section, and with volunteers can also be registered as critical workers supplying food and emergency relief.
Yeah, that's a good question. So as long as the volunteers meet all of the other requirements, then they can be considered to be critical workers. And as far as the specific food and relief one goes, as we discussed the other week, there is a provision that's not inside the community services, that's not in the community services list that may apply. But I'm just mindful of not giving kind of a sort of a definitive and black and white answer as to all food and relief services, critical workers would be in or out. You'd still have to assess it on a case-by-case basis, but it does appear that there's provision in the list and in the directions for that to occur.
Another question for both PPE and rats. How long will you be supplying the PPE and rats? Because this can go on for months.
It could go on for months. I'm going to have to ask you, Mike, because I don't know the policy decision that sat behind that.
I think we keep an eye on what the requirement is over time. Would be the kind of the high level summary there. We've got an additional allocation we'll be working with to get it out as quickly as we can. We see what happens. If more is required, I think we have that conversation at the time.
Rachel, you get the last question.
Okay, so one of the questions that's come up, and I've had this in other forums, is when you're registering critical workers, people are asking, is it the person or the role of the worker?
It's the role,
The role.
Rachel. Very
Yeah.
definitely. It's the role.
That's what people wanted to hear, that to be clear, that it is the role of the worker.
If they get onto the website and have a look, there's a really simple template that will help them gather the information, and it's basically, here are the identified roles, and this is how many people in my organisation fit within those roles. It's quite a simple template.
I am going to ask one more question because it's come up a few times. The rats being supplied, are they highly sensitive or very highly sensitive? You know, the TGA rating. Can anybody answer that?
It will depend. Basically, we'll err on the side of trying to get the rats out, because the government essentially has purchased quite a number through quite a few different channels. So there's different brands, there's different sensitivities. So the supply decisions will be made based on getting them out quickly, rather than trying to, I guess, sort of target particular kinds of rats to particular kinds of settings.
I will assume though they're TGA approved in the higher end categories and the lower end category.
Absolutely, they're all TGA approved, yes.
Thank you. Back to you, Mike.
Thank you very much. Well, that was a bit of a rapid fire exercise, wasn't it? And it's probably a stack of questions that we haven't got to. I'm not sure whether we're giving an undertaking to try and deal with those after the event or not. We are apparently. So we'll try and work with our colleagues on WACOS and DPC and others to try and answer. We'll probably group them up into sensible thematic groupings rather than try and answer them individually. But thank you very much for your participation today. Obviously, COVID is here, and I think the peak is predicted to be by about the 15th of March or thereabouts. So time is of the essence. We are working really hard to try and get this stuff out to you as quickly as we possibly can. There is the slide on the screen shows the links that are available for you generally in relation to information about COVID-19, as well as the government's COVID-19 website. There's both addresses are there, and of course, if you have any other questions, please email us at sectorsupport@communities.wa.gov.au. We'll endeavour to come back to you with the answers that weren't addressed today. Thanks very much for participating, everybody. Thank you to WACOS for your engagement, advocacy and partnership with the state government on this important issue. Thank you to our colleague at DPC, Scott, for joining us today, and for everybody else who made it happen. We look forward to continuing to work with you as together we manage this challenge. Thank you very much, everybody, and good afternoon.